Hello everyone, in this video we're going to go over 15 questions from the cosmetology exam. I'll share some tips and tricks to help you remember the correct answers. Our first question is, naturally curly hair with an uneven curl pattern can usually be successfully permed with heated clamps, a body wave, very narrow rods, or an alkaline waving lotion. Now we know it isn't heated clamps because this changes the curl pattern with heat, not a perm. We also know it's not a body wave because while this is a type of perm, it relaxes the hair to be more wavy than curly. Very narrow rods. Now this answer is somewhat tricky because depending on the client's curl pattern, you may use very narrow rods to even out their curl pattern. But it's not this choice because depending on the client and their curl pattern, you may use a different size rod. That leaves us with an alkaline waving lotion. By process of elimination, we now know this must be the answer. You can also remember that this is the answer because all perms use an alkaline waving lotion to break the hair's disulfide bonds, allowing the hair to be reshaped regardless of the curl pattern you're hoping to achieve. All right, question number 2. The small root area at the base of the hair, which receives nutrients from the follicle needed for hair growth, is the cortex, sebaceous gland, inner root sheath, or papilla. We know it isn't the cortex because the cortex is inside the hair shaft, not at the base of the hair. We also know that it isn't the sebaceous gland, as this is a gland that produces oil. You can remember this because sebum is oil and sebaceous comes from the word sebum. Inner root sheath and papilla are our last two choices. While these two answers are close, the correct answer is papilla. You can remember papilla by thinking of it as the parent that receives nutrients and nourishes the hair. So remember, papilla is the parent of the hair. Our next question is, if you use a dry sanitizer in the salon, it must comply with which of the following? Contain an active fumigant, contain 100% alcohol, be used in a well-ventilated area, or be approved by OSHA. Now we can know that the answer isn't contain 100% alcohol because alcohol is a liquid and the question is asking about dry sanitizers. We also know it isn't be approved by OSHA because even though OSHA deals with workplace safety, they do not oversee the specific rules for sanitation. So that leaves us with the last two choices, contain an active fumigant and be used in a well-ventilated area. They may both seem right, but the right answer is contain an active fumigant. You can remember that this is the answer and that the answer has the word fumigant because a fumigant is a gas that can be used in the air, which is also a gas. And gases are dry. So remember, fumigant is a gas, air is a gas. Fumigants can be used in the air. And they're both dry. Our next question is, which of the following diseases is defined as an infection caused by a tiny mite? Is it pediculosis, chickenpox, scabies, or psoriasis? We can rule out pediculosis because this is lice, not mites. And you can remember this because pediculosis has an L in it and lice starts with an L. It's not chickenpox or psoriasis either because while these are infections on the skin, they aren't caused by an insect. That leaves us with the correct answer, scabies. Scabies and pediculosis are easy to get confused, so you can remember mites causes scabies by remembering the mnemonic phrase, scratchy mites causes scabies. All right, our next question. Which style of bangs best complements wide set eyes? Is it high half bang, no bangs, full low volume bangs, or long bangs? We can immediately eliminate the choice of no bangs because we know the answer to the question involves bangs since it specifically asks, which style of bangs? This leaves us with the other 3 choices of bangs. The correct answer is high half bang. For me, the easiest way to remember that this is the answer is to remember that high half bangs is 3 words, and so is wide set eyes in the question. The other 2 choices don't have the same number of words as wide set eyes.